Hi guys, welcome back to my channel. If you're new here, please go ahead and subscribe to the channel so you do not miss the next time that I do post. This video, I just want to give you guys a bit of an update as to my nursing journey because I got accepted into Pace University for their ABSN program, which is just their accelerated nursing program for fall 2024. And once you get accepted, like everyone's always like, now what's there to do? What's the process of starting school, getting prepared for the actual semester? So I'm here to share with you guys exactly what I've been doing and all of the craziness that's been going on since getting accepted. First thing after you get accepted to any school really that you have to do, you need to pay a deposit. This is going to vary based off of the school that you go to, but for Pace, because that's where I'm going and that's what I can speak on, I had to pay $300 to hold my spot. They only gave me 2 weeks. Just 2 weeks in order to come to a decision if I actually wanted to go to that school and to pay my deposit. I did say before I was only planning on applying to Pace University, and it was a no-brainer. I paid my deposit right away. The same day I got my acceptance letter, I paid my deposit. I made a whole video talking about all of that before. So I paid my deposit. And then after that, now, usually there's a lag. You're waiting for emails telling you about things that you need to do. With nursing school, same thing for PA school, medical school, you need to then do a medical clearance. Most colleges usually have you just do an annual physical, but for people going into healthcare, it is a little bit more extensive. You have to do a lot of blood work to make sure you're immune to a lot of these common illnesses. So I had to do that. I had to do 2 separate medical clearance, and I was having so many issues going back and forth with my doctor. I've literally been to the doctor 3 times within the past month. So between April and May, I've been to the doctor 3 times, and I'm going to have to go again next week. So it's going to be 4 times within the span of 1 month. Other things I had to do was purchasing my scrubs. So I have to make sure I have my scrubs for the first day of school. They gave us a deadline. I believe we have to order our scrubs by August 1st, and that's mainly because the tops have to have the school logo, and that takes a while to customize. So you need to make sure you order it so you would have it for the first week of class, because you're going to need your scrub the very first week of school. You're going to actually need to have them, and that is a very hard and strict requirement that you, one, have to buy it from the school's vendor because it needs to have the school's logo, and then 2, you need to have it by the first week of class. So my first pair of scrub cost me around $70 for just 1 scrub top and a scrub bottom. I'm not gonna lie, I did not know scrubs were that expensive. I remember talking to my friends who are already in the healthcare field about this. I was like, yo, why did y'all tell me how pricey these scrubs are? And it's even worse because I have no choice but to use the school's vendor when I could 100% get scrubs for cheaper at other places. But that is besides the point. I've ordered 1 pair. I plan on ordering a 2nd pair because the way my schedule is going to be, I'm going to have 2 clinicals every week or 2 labs where I need to wear my scrubs every week. So I'm not going to be wearing the same scrub 2 days in the same week. So I want to order at least 2 pairs. Maybe I'll get a 3rd pair. We'll see how my budget is looking. I also had to order my nursing school kit. So this is going to be all the supplies I'm going to need for my labs for the entire time I'm in nursing school. That was around $230 something for that kit, which it's a lot of money up front right now, but I'm going to be using that for the 3 semesters I'm in the school. So for the entire year that I will be in nursing school, I will be using this kit. So the cost makes sense. This is something that I did not know. And if you're thinking about going back to school for nursing or any healthcare profession, apparently, you have to pay for your own drug test and background check. I had no idea that I would have to do that. And the thing is, I had to use the school's vendor for my drug test. I couldn't just go to my regular doctor and have them do a drug test on me, which would have probably been covered by my insurance. I had to use the school's vendor, so that was an out-of-pocket fee. And I haven't done it yet, but I need to do my background check, which is, again, out-of-pocket fee. Altogether, that is going to cost me over $200. So right there already, that's, let's say, about $500 I've spent. And if we take in the deposit, that's $800. So close to $1,000 already. And that's not including the fact that I need to get school supplies. Luckily for me, which I mentioned in my last video about, how to budget and save money when going to nursing school, I had created a nursing school wish list. So I added a lot of the things, a lot of essential things that I needed on this wish list. I'm very thankful and very blessed that I can say a lot of the things I had on my wish list have been bought. Even when I made that last video, I mentioned some of the items that I was aware that came off of that list, not knowing a very close family friend had bought like 4 other things and it had came off the list and I just was not aware. So if you do look at the wish list, because I did post my wish list in that video, a lot of the items are off. I will make a haul video so you guys can see all the things I've gotten. Maybe that will be my very next video, just so you guys can see the items I already have. And when I say I'm really trying to save as much money as I can in terms of not having to buy relevant and important supplies, I definitely put them on that wish list because I need it. And if other people are willing to gift them to me, that would be great. And thankfully, I have a great support system. I have family and friends who genuinely show up for me every time and got me some of those items. Now, I will say, honestly, I have been in a very, weird space when it comes to nursing school. I'm excited, but it's also stressing me out with the health clearance because I had to keep running back and forth to the doctor. I have to keep doing so much things for it. And me, I don't like going to the doctor. I don't like needles. I'm very much aware, but I still do know I need to give the blood in order to get these labs. At the same time, I'm very excited. I did get part of my schedule for nursing school, so I will put it on the screen as well. For research, my research class, it actually is asynchronous. It's completely online, but I'm putting that I will watch my lectures on Mondays from 9 to 11. I don't know how long the lectures are. I just put out that block of time for right now. If I need to extend it because the lectures are longer, I will, but I do typically watch my lectures in 2x speed anyways. And I have Patho Pharm recitation, 7:55 to 8:50. I was told by a current student that time slot is really mostly for testing, so I don't really have to go on a regular week-to-week basis. Granted, with ABSN programs, you usually do have an exam every week, so who's to say, right? And then for Patho Pharm, the actual lecture, that's from 9 a.m. to 12 p.m. It's a 3-hour class, which that is a very heavy material class, so I understand why it's 3-hour long. I have psychiatric mental health nursing 225 to 425, and this is Tuesday, by the way. This is on Tuesday, so that's only a 2-hour block. I am going to be taking a clinical for psych. I don't know when yet, but it's going to either be Thursday or Friday, so I don't have any information about my clinicals, but I will be taking a clinical for psych. That much I do know. Fundamental is Wednesday morning, 7:55 to 9:55. Once again, 2 hours. I also will have a clinical for fundamentals of nursing. Once again, do I know when? No, I don't. It will either be the Thursday or Friday. Those are the 2 days reserved for labs and clinicals. Because we're still doing our health clearance and those are not due till July 1st, they have not made our clinical groups yet, because that's going to be based off of who actually are in compliance with their health clearance, and then figuring out who is close together and what hospital that they have a partnership with that they can place us that's close to where we as a collective group live, which that takes a lot of work, and I understand, but at the same time I want to know so I can just put it on my schedule and just be like very, so I can start mentally preparing myself for all the things I need to do and know. My last class is communication of professional nursing from 1:20 to 3:20. Once again, 2-hour block. That's not bad. Pathopharm is my longest class, and I'm kind of happy like that's the only 3-hour class, and after that class we do have a good break so I can go over the notes right after and like review while I'm having my lunch and preparing for my next class. Tuesdays are not bad, especially if I really don't have to go at the 7:55 and I can go at 9. I can sleep in a bit more. Wednesdays I am going to have to be up early because of that 7:55, but that's okay. We'll get it done if we have to, but like that's really the update for nursing school, just getting my health clearance all together to make sure I'm in compliance so I can actually attend my clinicals, and just getting as much supplies as I need. They have not sent out the tuition yet, so I don't know how much it's really going to be the actual cost, because the $300 deposit goes towards our first semester tuition, and I also did get one federal student loan, which I believe is around $700 something that will be going towards my first semester and the same amount for the second semester, so not really a lot of money. And tuition is projected to be around $25,000, but I won't be doing like a meal plan. I will not be doing their health insurance, so that will help to bring the cost down a bit, and we're all going to collectively pray that I get the scholarships I applied for. I won't know the result for any of the scholarships that I have applied for until like the summertime. I believe one I will hear back from in June, one in July, and one in August. Those are the only 3 that actually let me know when they will be announcing their winners. Other ones I've applied for, they did not give us a date as to when the winners will be announced, so I just have to wait out and see if I get those. But really and truly, I'm praying that I get at least a couple thousands in scholarships, because that will help a lot towards my first semester, even though it won't help towards future semester. If I can get my first semester costs low, I can work and save, and my family, aka my dad, can also save for the later semester, because this first semester we don't have to worry too much. But that's really the plan, that's really the goal. And like I said, I'm both anxious, a little bit stressed, but at the same time I'm very excited, because this is a journey that I'm going to go on. Like last year this time I had no idea where I would be now. I was just looking and I think applying to summer classes so I can actually finish up my prereqs that I needed, and now a year later I'm actually like looking forward to starting nursing school. It's crazy what 1 year can do in your life. I hope you guys enjoyed this video. If you guys have any questions at all in regards to like PACE and their Accelerate BSN that I can answer, because obviously I have not started, I will be glad to answer that. Just drop them down below. If you have any advice, if you've done nursing school before, or if you're in nursing school currently, please leave me some advice, words of encouragement, anything, guys. I will gladly appreciate it, like, because I know it's not easy and I'm not expecting it to be easy. I hope this was of value to you. I hope you guys gained some insight as to the program I'll be attending, and I will see you guys in my next one. Bye, guys.